Okay. Bonjour et merci de vous.
Good afternoon and good morning, and thank you for joining us today. I would like to first send out a word to Canada's children. I know this is a difficult time for you. You're stuck at home and you can't go out to see your friends. However, Sunday is Mother's Day, and if you can give your mom a big hug and maybe help your family by cleaning the house, I am sure that all moms across the country would really appreciate that.
By saying something to all the poor children of Canada. I know that this is such a difficult time for you, cooped up at home and not able to go and play with your friends. But Sunday is Mother's Day, and I would really like to say, if you can, give your mother a hug, give her a kiss. If you can, maybe help clean up the house a little bit. It's hard for you, but it is really also a hard time for parents across the country. And I know your parents, and especially your mothers, would really appreciate it. And in the interests of disclosure, I must say I do have a personal interest in sharing this message with the children of Canada. So today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, by video link, our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, par vidéoconférence, le ministre du
Via video conference, the Minister of Canadian Heritage, Stephen Guilbeault.
Science and Industry, Navdeep Bains, et le Président du Conseil du Trésor,
and the President of Treasury Board, Jean-Yves Duclos.
Good afternoon and bonjour à toutes et à tous.
Good afternoon to all of you.
On COVID-19 in Canada. There are now 65,399 confirmed cases, including 4,471 deaths, and 29,000 or 45% of cases have now recovered. Labs across Canada have tested over 1,032,000 people for COVID-19, with about 6% of these testing positive to date. In the past week, we've tested an average of over 26,000 people daily. We've had quite a few questions about lab testing capacity versus our daily lab testing levels. So I want to take a moment to explain this a little bit further. To be clear, when we talked about a current lab capacity to do 60,000 tests a day in Canada, this is about building up our ability to detect any surge in cases as we relax public health measures. Specifically, a robust testing capacity is a vital component of our case finding, contact tracing, isolation and quarantine approach to rapidly corner the virus. So how do we know we are testing enough? One relatively simple international benchmark for testing is the percentage of tests that come back positive. The lower the percentage of positive tests, the better your surveillance is. When the positive test is really high, it means you're missing a lot of infections. The WHO benchmark is to aim for a positivity rate of 10% or below, striking the balance between casting the net wide, that is high sensitivity, while targeting testing where the virus is most likely to be spreading. Canada has maintained a percentage positive rate below 10% throughout the epidemic. Most encouragingly, our average weekly percent positive rate has been declining from 9.8% in early April to about 4% now in early May. At the same time, we have doubled the number of people being tested weekly since early April, indicating we are casting the net wide. Right now, our testing strategy is evolving as the epidemic slows. In many areas of Canada, testing is broadening to include people with a range of milder symptoms. Provinces and territories are increasing their testing to target people working or living in higher risk settings, such as healthcare, long-term care, correctional facilities, certain work and congregate living settings. When it comes to testing, it's not the number that matters so much, but knowing that you are testing the right people at the right time in the right place. There are multiple other ways that have been proposed to gauge whether countries are testing enough. Regardless of the method, Canada stacks up well against other countries, but we can always do better. This is why we continue to increase our testing capacity. Thank you.
Okay. Thank you very much, Dr. Tan. Et maintenant, je donne la parole au docteur.
And now, Dr. Howard New. Dr. New, please.
Sure.
Thank you. As usual, I will start with the latest numbers on COVID-19 cases in Canada. There are currently 65,399 confirmed cases, including 4,471 deaths and 29,000 now recovered, or 45%. Labs across Canada have tested over 1,032,000 people for COVID-19 to date, with about 6% of these testing positive overall. In the past week, we've tested an average of over 26,000 people per day. We've had quite a few questions about laboratory capacity versus our daily laboratory testing levels. So I want to take a moment to explain this further. To be clear, when we talked about a current lab capacity to do 60,000 tests a day in Canada, this was about building up our ability to detect any surge in cases as we relax public health measures. Specifically, a robust testing capacity is a vital component of our case finding, contact tracing, isolation and quarantine approach to rapidly corner the virus. So, how do we know we are testing enough? One relatively simple international benchmark for testing is the percentage of tests that come back positive. The lower the percentage of positive tests, the better your surveillance is. When the positivity rate is really high, it means you're missing a lot of infections. The WHO benchmark is to aim for a positivity rate of 10% or below, striking the balance between casting the net wide, high sensitivity, while targeting testing where the virus is most likely to be spreading. Canada has maintained percentage positive rates below 10% throughout the epidemic, and most encouragingly, our average weekly percentage positive rate has been steadily declining from 9.8% in early April to about 4% in early May. At the same time, we've doubled the number of people being tested weekly since early April, indicating we are casting the net wide. Right now, our testing strategy is evolving as the epidemic slows. In many areas of Canada, testing is broadening to include people with a range of milder symptoms. Provinces and territories have increased their testing capacity to target people who are working in and living in high-risk areas, such as those working in healthcare, long-term care, correctional facilities, and certain work and congregate living settings. When it comes to testing, it's not the number that matters so much, but knowing that you are testing the right people at the right time in the right place. There are many other ways that have been proposed to gauge whether countries are testing enough. Regardless of the method, Canada stacks up well against other countries, but we can always do better, which is why we continue to increase our testing capacity. Thank you. Thank you, Dr. New.
I'll turn it over to Carla Qualtrough. Carla, please.
Thank you, and good afternoon, everyone. Today's numbers of 2 million jobs lost in April show that COVID-19 is having a real impact on communities and families right across the country. Since the beginning of this crisis, we've been focused on providing Canadians with the support they need as we work together to contain the spread of the virus and on ensuring we have the tools in place to keep our people safe. C'est pour cela.
That's why our government has taken unprecedented measures to support Canadians and their families during this difficult time.
We introduced the Canada Emergency Wage Subsidy to help keep as many Canadians as possible working. To help Canadians who have lost income due to COVID-19, we introduced the Canada Emergency Response Benefit, which provides $2,000 a month to those who need it most. Along the way, we've worked to ensure this benefit is as inclusive as possible to reflect the different realities that Canadians face. To date, over 7 million Canadians have access to the CERB. We know that today's job numbers also demonstrate the real challenges that young people are currently facing in our country. While many have been able to access the CERB, many other young Canadians are anxious about their employment prospects, especially this summer. That's why we announced the Canada Emergency Student Benefit. Students who are not eligible for the CERB will be able to apply to receive $1,250 per month between May and August. Students with permanent disabilities and those with dependents could receive an additional $750 per month. We know that you have additional expenses during this crisis, and we are here to support you. I'm happy to say that we'll have more details about the application process for the CESB soon. In the meantime, eligible students should set up their MyCRA account to set themselves for direct deposit so that when applications begin, they can get their first payment very, very shortly. Ces initiatives ainsi que la
These initiatives, as well as the top-up for the Canada Child Benefit and the GST credit, will quickly get more money to Canadians when they need it the most.
begin to lift restriction and our government continues to take steps toward economic recovery, we'll be there for Canadians. We'll get through these challenging times together. Thank you. Merci.
Okay, thank you, Carla. Et maintenant, je donne la parole à Stephen.
And now I will give the floor to Mr. Guilbeault, the Minister of Heritage. Go ahead, Minister.
Hello, everyone. Our culture, heritage, and sports sectors are going through a major crisis. They're under enormous financial pressures because of the isolation measures that deprive them of their audience and their income. The situation is critical. We've moved quickly to stabilize these sectors, which are an important driver of the Canadian economy. On April 17th, the Government of Canada announced a fund of up to $500 million to help the cultural, heritage, and sports sectors. Today, I'm pleased to announce the details, as I know that many are eager to hear more.
The fund will be paid out in 2 stages and will help, amongst other things, meet the needs of organizations which have been touched, will help maintain jobs, and will help keep organizations going whose cash flow and operational viability in the short term are undermined by the pandemic. The fund comes on top of Canada's COVID-19 economic response plan to make sure that no one is left behind.
Will distribute financial support through its program and will work closely with its partners, specifically the Canada Council for the Arts, the Canada Media Fund, Factor, Musique Action, and Téléfilm Canada.
Our decisions with regard to funding will take into account traditionally marginalized communities, as well as the LGBTQ2, Aboriginal, and minority official language communities.
On the Canadian Heritage website, our program officers will be in direct contact with the organizations through the usual communications channels starting today. They will do everything they can to address the most pressing concerns. We know that organizations are facing all kinds of serious challenges right now and are doing their best to get through it all. This is why we've put together a streamlined process to distribute these funds.
Our artists, creators, and athletes are key to building healthy, tight, inclusive, and proud Canadian communities. During the lockdown, they helped us feel a little less alone. Their resilience and their acts of solidarity have touched us all. They're still there for us, and we want to be there for them.
Behind our creators, artists, and athletes, and we have a message for them. We miss you, we need you, and we will meet again in person.
Okay, merci beaucoup, Stephen.
Thank you very much, Stephen.
I'm going to hear from the Minister of Innovation, Science and Industry, Navdeep Bains. Please, Nav.
Thank you very much, Christia, and good afternoon, everyone. Since the beginning of this crisis, our goal has been to do everything we can to assist our frontline workers and to ensure the safety and support of Canadians as we navigate this pandemic and these unprecedented economic times. As today's job numbers show, many people are hurting because of COVID-19.
We know that workers in certain sectors were hit very hard. We have to understand their challenges and we have to continue to support them.
Our approach is to be proactive and strategic and designed to bring the private sector to the table to directly share their perspectives on the scope of the challenges being faced. As our government examines what is needed in this immediate crisis, we need to fully understand all of the challenges. Effective immediately, we're establishing an industry strategy council tasked with helping us identify these challenges. The council will leverage an existing and trusted public-private forum known as Canada's Economic Strategy Tables, where business leaders can share perspectives regarding the challenges they're facing as a result of COVID-19. In response to some particular pressures related to the pandemic, we're adding 2 new tables representing the retail and transportation sectors. They join our existing tables, which have been represented by advanced manufacturing, agro-food, clean technology, digital industries, health and bioscience, tourism and hospitality, and resources of the future. Les membres du Conseil.
Over the next 90 days, the Council will meet regularly to identify and understand sectoral pressures that are common across our economy, and members of the Council will help us better understand the challenges.
From workforce disruptions to reestablishment of supply chains and consumer confidence, to name a few. Je remercie Monique Le.
I would like to thank Monique Leroux, who has accepted our invitation to chair the Council. Ms. Leroux has one of the most distinguished careers in Canadian finance, and her impressive background makes her the perfect fit to lead this Council.
We'll be announcing the rest of the Council members in the coming days. Just as we've seen with industry stepping up to assist with personal protective equipment production and medical countermeasures, we are going to work in collaboration with our industry to understand and to make sure that we come out of this stronger and we come out of this together. And with the help of the Industry Strategy Council, we'll do exactly that. Thank you very much. Merci beaucoup.
Okay, thank you, Nav. Maintenant, je donne la parole.
And now, I will give the floor to Jean-Yves Duclos, the President of Treasury Board. Go ahead, Jean-Yves. Thank you very much, Christia, and hello to everyone. The message this morning from the Prime Minister is a message of hope and courage following the recent Statistics Canada survey on unemployment. I'm an economist, and for me, the statistics are shocking, but as a member of Parliament, this is unbelievable because behind the numbers are thousands of families and workers affected by the crisis. Thankfully, we can count on each other to come through this pandemic thanks to the measures the Canadian government has already announced, including the Canada Emergency Response Benefit, the Emergency Wage Benefit as well, which was mentioned again by the Prime Minister this morning and which will be extended. So it is in a context where we know that after the crisis, if we keep on taking care of each other, not only will we all be stronger, but we will always keep on looking after each other. Thank you, Christia. Thank you, Jean-Yves. We are now ready to take questions.
As usual, we'll start on the phone with 3 questions, 1 question, 1 follow-up, and then we'll turn to the room. Operator.
Thank you. Please press star 1 at this time if you have a question. Puis, s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question, est de Marie Vastel du Devoir. À vous la parole.
Oui, bonjour.
Yes, hello. My question is for Minister Qualtrough, and it is about the Canada Emergency Response Benefit. Schools and daycares are starting to open. In Quebec, it'll be on Monday, and yet some teachers and daycare workers feel that going back to work would be a threat to their own health and safety. So I would like to know whether a personal assessment should be carried out if a person feels they might be in danger if they go back to work. And if so, would that person still be eligible for the CERB if it is deemed they can stay home? Thank you for the question. It's an important question. Of course, we want to be sure that Canadian workers are safe when they go back to work. And we expect workplaces to do everything they can to ensure the health and safety of their employees by working with public health authorities. There are guides for employers to ensure that workplaces are safe. Now, of course, a worker has the right to refuse to work if he or she does not feel safe in the workplace. But for us, the point is to work with employers to ensure that the workplaces are indeed safe so that all workers can feel confident that their own health and safety are the priority of the employers. So you are saying that a person has the right to refuse to go back to work? In other words, can daycare workers decide not to go to work and still be eligible for the Canada Emergency Response Benefit? Would such an application be accepted? Well, the CERB is available to anyone not able to work for reasons related to COVID-19. If you cannot work because of COVID, you're eligible. It's a personal choice, but I want to reinforce the message that we want Canadians to go back to work. And we want employers to create safe workplaces where the health and safety of their workers is of utmost priority.
Thank you. Merci. The next question, la prochaine question, is from Mike Blanchfield from the Canadian Press. Please go ahead.
Hello, Deputy Prime Minister. This question is for you. The job loss numbers out today are at historic levels in both Canada and the U.S., and yet we're seeing dramatically different responses. There's pressure in the U.S. to reopen the economy and get back to work, but that hasn't seemed to manifest itself in Canada in the same way. How do you explain the difference?
Thanks for the question, Mike, and it's nice to hear your voice. You are absolutely right that the jobs numbers are historic and are and should be profoundly worrying for all Canadians. Our country is going through a very, very trying economic time. In terms of what that means when it comes to our government response and to the response of Canadians across the country, I think Canadians are so smart and they are so sensible. We all knew, we all understood that physical distancing, that shutting the country down was an essential response to the coronavirus. We understood that, we got that, and I'm so proud of Canadians for following that advice. And the good news is, as a result of following that advice, we are making real progress in beating the virus. The same sensible, prudent, smart approach needs to guide the restart. And I think Canadians understand profoundly that the biggest mistake we could make right now would be to squander our hard-won gains. It has been really tough to get here, and the job numbers today show what a big sacrifice we have been making. Our job now, collectively, is to build on that progress and to be sure that as we look towards restarting the economy, we do it very carefully, very prudently, and in a way that will prevent the virus from surging back and enveloping us all. What that does mean, that careful, prudent, smart approach, is that the government has to be there to support Canadians who are doing the right thing. And that is why our government has put in place the largest economic program in Canadian history to support Canadians and to support Canadian companies. We are making really good progress. There is still a way to go in the fight against the virus. And as the Prime Minister said earlier today, the government is here to support Canadians, to support businesses as we finish off that fight. We're going to get there.
Mike, follow up.
Yes, Deputy Prime Minister. Well, given this hard effort that has gone into all of this to get us to this point, what are you saying in your discussions to the United States about the uneven approach that's taking place down there, and what concerns are you expressing about how this might affect Canada, given that it's our largest economic partner, our neighbor, and we share a border with them?
Well, let me just say, Mike, first of all, that we had a very productive conversation yesterday, the Prime Minister and the Premiers. I was fortunate enough to be able to be part of that conversation too, about the restart, about the continued efforts to fight the coronavirus, and also about our border with the United States. In terms of our conversations with the United States, they have been very appropriate to our relationship. They have been really neighborly. They've been really practical and really effective. The border measures that we have put in place, which are unprecedented and have restricted non-essential travel, but have allowed essential travel to continue, have really worked. And our experience of them in Canada is that those border measures have cut down travel across the border very, very much. But at the same time, essential travel continues. We have been in touch with our American partners, and they have exactly the same experience on their side of the border. So that shows that they are really effective. And I think that that is really positive for Canada, for Canadians, for our economy, and it speaks well of our relationship.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Merci. The next question, la prochaine question est de Micheline Laflamme de Radio-Canada. À vous la parole.
Micheline Laflamme, Radio-Canada. Thank you, Mr. Baines. You chaired the Industrial Strategy Council. What do you expect of this council? What will it do in the next 90 days? Are you expecting short-term recommendations? And what economic sectors will be a priority for the Industry Strategy Council? Thank you for your question. I would like to point to the importance to the exceptional leadership of the Council. Monique Leroux has experience in the retail and auto sectors, amongst others. She has a lot of experience, and I am sure that she will work with myself and my colleagues to pinpoint the challenges in each of these sectors. For the moment, we are focusing on addressing the crisis now because the situation is very serious. Over time, however, I hope that we will be able to find solutions to help improve the conditions for workers. Micheline, a follow-up. Ms. Freeland or Mr. Baines, we know that large American auto manufacturers will soon open up their plants again. Have you spoken with your American counterparts, and how are plants going to be reopened in Canada, auto plants? Well, allow me to begin, and Nav can complete my answer because I know that Nav is working closely with our automotive sector. That's a very good question. And it is key for us to work with our American partners. I know that the Canadian automotive sector is very integrated with the American auto sector. Our industry also has a great deal of international experience within the context of the coronavirus. Many Canadian companies today are working in China in conditions where COVID-19 is present. So I know that our sector has a lot of experience. It will find a way forward, and our sector is working closely with the federal government, with the Americans, and with the provinces. Nav, would you like to add something? Yes, I agree with what my colleague just said. She is right. So, straightforward. We have to work with our American partners. The auto sector is as present in Canada as it is in the U.S., and both sectors are integrated. However, our first priority is the safety of Canadian workers, so we will look at the situation closely every day. However, I am sure that the sector will find solutions which will be to the benefit of workers.
Starting with Rachel Haynes from CTV.
Hi, ministers and doctors. Rachel Haynes from CTV National News. My first question actually goes to Dr. Tam about the outbreak at the Cargill meat facility and the outbreak in High River as well. We've seen a large number of people who have been infected there, but a small number of deaths in that community. Can you tell us a little bit about why you think that is when there is such a large outbreak that there would be such a small number of fatalities?
So obviously the province of Alberta is working extremely hard, and my colleague, the Chief Medical Officer of Health there, so they are, providing guidance to the industry and trying to, as rapidly as possible, get these outbreaks under control. In terms of deaths, I mean, obviously right now the outbreak is still undergoing evolution, but we know that the fatalities mainly occur in people over a certain age. So it's definitely over 60, but obviously at 70 or 80 years old, you're at a higher risk. So I think part of this might be related to the age groups that might be affected. But we also know that it's not just the workers, it could be their families. So it may depend on what families the workers might be living with, for example. But we do know that the case fatality is driven, very much by the long-term care facility outbreaks right now. So I think the work environment is different, but it is definitely a setting where, really rapid response when we get cases, in terms of testing and case finding and contact tracing is very important.
Thank you. And my next question is a bit of a two-parter for Mr. Duclos and Minister Freeland. About the wage subsidy, Mr. Duclos, you said a few days ago that businesses would start seeing that wage subsidy. So have all businesses who have been approved gotten that money? And as well, the Prime Minister did say earlier today that as we start to reopen economies, more people will be going back to work and will need the wage subsidy more so than the CERB. But for businesses who have had to shutter completely, for those people, and after June when they don't get the CERB anymore, what is available to them?
Thank you. If I may start with the statistics on the emergency wage subsidies. So as of yesterday, 120,000 businesses had applied, and almost 100,000, I think the precise number is 97,000 of them had their application approved, for a total of 1.7 million workers. So these are a large number of workers, and we are very not only proud of the impact of that program, but we're also very mindful that this is going to be important as we move forward. As you said, the value and the objective of that program was to maintain the important relationship, worker-employer relationship as we move through the crisis. And the great news is that a number of businesses, and we expect that to be continuingly improving, a number of these businesses are going to be able to maintain that important relationship. And as the Prime Minister announced this morning, we believe that it's important to extend that wage subsidies so that businesses have the ability to hire even more workers on the wage subsidies.
Yeah, and I'll just add, I very much agree with Jean-Yves, and I would just add, the wage subsidy program is really, really important, particularly now as we are able to begin looking cautiously with great prudence towards economic reopening, because we really all appreciate that the reopening is going to have to be very careful and very gradual. And what the wage subsidy does is it allows a business to operate even not at full capacity. And it allows that business, which is operating not at full capacity, to continue to employ and pay its workers. And I think that the wage subsidy has been a great tool so far. I think we're going to find it to be an even more valuable tool as we carefully move towards reopening our economy.
Businesses who have shuttered and won't be reopening even in the next few months?
Well, there is an ability for not only rehiring, but hiring workers and new workers included. So it's designed in a manner that gives the businesses the flexibility on the decision and the timing of the decision that they want to use. So it's designed for that particular purpose. We understand that businesses have faced the crisis in many different ways, and that they may want to start hiring new workers at different times, and that's why extending this wage subsidies is important.
Merci, Monsieur le Ministre. On va repasser au...
Thank you, Mr. Minister. Questions.
La prochaine question est de Émilie Bergeron de l'agence.
Émilie Bergeron. Thank you. My question is for Mr. Duclos. As far as the wage subsidy is concerned, or perhaps for Ms. Qualtrough, now, this program is being extended, and so what is the potential cost of this measure? According to the Parliamentary Budget Officer, we're up to a cost of $75 billion. So by extending this program, how much could it potentially cost? Of the applications received, how many have been processed so far? Now, with regard to the fiscal impact of this measure, even though we would like to have an exact figure, it's hard to know what the number will be because we are in a period of uncertainty. The Parliamentary Budget Officer has done very good work forecasting, but there's no accuracy in the current uncertain context, and we don't know what the number will be until June 6th or what the number will be after it is extended beyond June 6th. As for, or rather, Émilie, would you mind repeating the question, please? Your second. It was a question on the applications received. How many have been processed so far? 1,000 applications have been received. 97,000 have been approved for a total of 1.7 million workers. Do you have any further questions? Ms. Qualtrough answers. It's an important program, but we still don't know how the emergency response benefit will affect the emergency wage benefit. We're studying the alignment between these two programs. Over time, we will better understand how many workers are choosing to renounce the CERB in order to go back to work thanks to the wage benefit. Thank you very much. Follow-up question? Yes, I have a second question for Ms. Freeland. many workers, many orderlies and nursing aides in long-term care facilities are asylum seekers whose application has been rejected. There are many Haitians who arrived in 2017 today. They are working extremely hard, often at a risk of their very lives. Are you looking at regulating their status? Thank you for the question. I would like to begin by thanking everyone who is working to help our seniors in extremely difficult conditions and dangerous conditions. They are doing an essential job, and I would also like to highlight the work of the men and women of our armed forces who are lending a hand in this situation. So thank you to all of you. You're working very hard for your country. Now, with regard to the asylum seekers, as you know, Canada has a fair system in place. Canada's system is well regulated to determine who has the right to asylum in Canada. So it is very important for us to be a rules-based country, and we will continue to be a rules-based country.
Operator, next question, please.
Thank you. Merci. The next question, la prochaine question, is from Althea Raj from HuffPost Canada. Please go ahead.
Hi, thanks. My question is for Dr. Tim. I'd like to go back on the comments you made at the outset of the meeting. You said, repeated basically that the 60,000 is the public health laboratory capacity. Now, that's been explained to us that is the amount of tests that can be done daily. If we are only doing an average of 26,000 tests, what is the problem? Do we not have enough tests? Do we not have enough people to administer the tests? Or what's preventing us from going to 26 to 60? Thank you.
There's a number of factors. That is the capacity of the public health laboratories. And what you want to do as you progress in this epidemic curve is to flexibly escalate testing as needed. So if you were in a certain province where the outbreak is actually under control, right now, those provinces are increasing their testing, not because they've got cases necessarily identified right now, but they are widening the net to test more people with, say, milder symptoms. So they may increase in testing just by widening the net, just to see if there's any ongoing community transmission, for example. Other provinces are in a very different situation. For example, of course, in Quebec and Montreal, where they are escalating testing right now to do broadening testing in that area where they're actually still having some outbreaks, knowing that outbreaks are occurring in their long-term care facilities, but also trying to see if there's any transmission that is happening in the community. So you're seeing them escalate the testing to fit with the epidemiologic needs, which is why I think part of it is that, there is no magic target to just keep testing at a certain number. It depends on where that epidemiology is at. But only to say that all provinces are looking at ways at which they make sure, when we're in the middle of that epidemic curve, a lot of people were told to stay at home. And if you got milder symptoms, you may call your health line and talk about when you get tested. But many of them would have actually sort of stayed at home, and their symptoms would have essentially resolved, and they would then be able to continue. But in this newer stage, these people will now be able to get tested, for example. That's how I think the numbers might go up, but it will go up and down. The percent positive tells us a little bit about how sensitive that system is. And for many of the provinces, they're at a very low percentage rate right now, which means while they're doing more testing, they're not detecting those positives. So it's not a straightforward, we must reach a certain number of tests per day. I think that will still fluctuate. The important thing is we've got that buffer, we got that surge, so that if there is a case or cluster the local area will be able to jump on that and rapidly increase their testing as needed as well. So that's the sort of idea going into that next phase.
Altia, follow-up?
Thanks. Yeah. So I appreciate all that you've said, and I think that you've kind of made these points repeatedly throughout the week. And we understand that the provinces are basically using their resources as best as they can to address their own unique challenges. But my question is, why are we not testing more? What is preventing us from going from 26 to whatever the magic number may be? It doesn't really the magic number is, but you and the health minister have both said that we need to have more testing capacity. We need to increase that. We need to have more tests done. More people need to be tested. So why are we not testing more people? You said there were a number of factors. Can you elaborate? What are those factors? Do we have enough tests? Do we have enough people to administer the tests? Why are we not testing more?
So I think it depends on where you're at in the country as well. So no, obviously, there is an actual public health laboratory capacity to do those tests. Some of it now depends on need and whether people actually need to test that many in order to ensure that they don't have community transmission. I think that's the most important. Two is that, as you've heard, every day we're managing laboratory supplies. Right now, we're addressing provinces' needs, but that is a very dynamic situation. So one day it could be managing swabs, the next day it could be reagents. But all we can say is that right now, with all the different streams of increasing laboratory capacity, that capacity is continuing to increase as we speak. But even in the last week, I think it was within the last week, you've heard about some of the newer point of care tests that we're hoping to put in place as well. But some of those are new innovations. And so the Spartan test, for example, required further testing. So every day there's a dynamic in that laboratory testing approach or strategy. So it could be a number of different factors. Right now, I'm not hearing anything specific about swabs or about reagents. But I'm not saying that next week or the week after, something suddenly wouldn't happen. But right now, based on all the provincial territorial, particularly provincial laboratory capacity, this is the capacity that they have in place.
It's Dr. New. Maybe I can just build on what Dr. Tam has said. As we both said repeatedly during this week, it's all about testing sort of the right people at the right time in the right place. So I just want to maybe unpack that a bit. So first of all, it doesn't make sense to just test people randomly. If people don't actually have the infection, what you're actually doing then is that by testing these people, you have a higher chance of getting what we call false positives. There's no test in the world that's 100% foolproof. And so you can imagine if you test a whole bunch of people who actually don't have the infection, then all you'll end up most likely is with a bunch of, quote, false positive results. So that's why it's important to test the right people who actually you think, obviously from a public health and clinical point of view, actually have the infection. So that gets to the second point in terms of at the right time. As we all know, the molecular test that we're using right now is all based on detecting the virus. And it may well be if you test someone who might actually really be infected with the virus, but they're still within the early part of what we call their incubation period, that means the viral load might not actually be high enough. So if you were to give a test at sort of the wrong time or too early, you'll actually get a negative result. And then 3, 4, 5, 6 days later, they may actually then develop the symptoms and have high enough a viral load to actually get a true positive result. So you might actually give a false assurance to someone with a negative test if you've tested them too early. The other point, though, is sort of like you say, in the right place. And so, as Dr. Tams pointed out, we're certainly, with the provinces and territories, focusing on those high-risk situations. If there's an outbreak in, for example, a long-term care facility, focus in testing and have, a higher level of diagnostic suspicion and testing both the residents and the staff in those types of settings. And then the last point, which I think maybe people may not quite understand, is that if you do a test at a certain point in time and you get a negative result, that doesn't clear you. It just means that up to that point, you haven't been exposed, you have not been infected, and test is negative. But if you go out afterwards and sort of, forget about all of the proper measures that should be taking place, like physical distancing, etc., and expose yourself, you may well still get exposed and get infected with the virus. So a negative test result also doesn't clear you sort of from that point
on. So I think those are the kinds of details that maybe need to be, I think, further underlined by both Dr. Tam and myself going forward. Thank you.
Okay, but my question
Thank you,
was
Dr.
really
Althea. It's one
about-
question, one follow-up. Sorry.
No, I
you
understand,
have
but
colleagues
my-
waiting. Sorry. Operator, next question, please.
Thank you, merci. The next question, la prochaine question, est de Catherine Lévesque de la presse canadienne.
Catherine Lévesque from the Canadian Press. Good afternoon. I just want a clarification from Minister Qualtrough. Daycare workers and teachers, many of them will be going back to work in the next few days. Do they have the right to work and yet still be eligible for the emergency response benefit? Thank you for the question. Well, my message is this. It is important for workplaces to be safe and that the health of employees be protected, and that this be the first priority of employers. Throughout Canada, workers have the right to refuse to enter an unsafe workplace. This is not what we want. We want workers, we want public health and employers and workplaces. We want all of these partners to work together to ensure that workplaces are safe so that workers can go back to work. Again, a workplace has to be healthy and safe. Catherine, follow-up? Thank you. My other question is for Minister Guilbeault. I don't know if it's fatigue or because it's Friday, but I don't quite understand what that fund will be used for. Can you give us more details on how the fund you mentioned will be disbursed? Based on information documents I've received, the organizations you mentioned will not be eligible for the CERB or the wage benefit if they take money from the fund. Thank you for the question. I would like to come back to the last part of your question. Just because an organization would receive money from the fund we have unveiled today or announced today, it does not mean that they will not be eligible for the other measures we've put in place, including the CERB. What we're saying today is that the arts, culture, and sport sector are so specific, so distinct that they need special attention, and that some of the measures we have put in place don't really work or work as well in these sectors as elsewhere. If you're a nonprofit, it might be hard for you to get credit from a banking institution because your room to act is already fairly limited. Many autonomous workers, self-employed workers are eligible for the emergency response, or rather are not eligible for the emergency response benefit. And so we are introducing new measures to plug the holes which we have discovered in the last few weeks. We're trying to help as many Canadians and organizations as possible, and we've realized that some of the measures we've introduced don't necessarily work for everyone. So we have set aside $72 million for the sports sector. Thanks. We have Olympic Games and Paralympic Games, and athletes can qualify for government support to participate in those games. Now, the Olympics have been moved back by 1 year. Many athletes have qualified for the Olympics, and this money will help them keep on training as well. New athletes would have arrived into the system after the Olympics, which would have been held this year, and they would also receive support from this $72 million fund. So money in this fund will go to organizations already being supported by Heritage Canada, including Telefilm, the Canada Council for the Arts, and others. We're also going to set aside money for organizations which do not receive support from Heritage Canada or other organizations. So we know full well that the programs we have now are helping many organizations, artists, and athletes, but not everyone. So given the scope of this crisis, we decided to create a new program to help those organizations. Thank you, Mr. Minister. A final question from the room.
Photo department. My question is for Freeland. Is the U.S.'s haste to reopen good or bad for Canada?
We are very clear in Canada that Canadian leaders and Canadian people make decisions about what's right for Canada. And I think none of us would appreciate it if other countries were to offer verdicts or judgments on our decisions. And I think that's the right attitude to take.
And my follow-up is actually a separate question, and it is for Tam. Elderly people that are at home that have been being very safe and not going out and getting maybe a friend or a neighbor to do their groceries, is it safe for them to go do their groceries right now?
So I think that depends on where you are, and it would be up to really listen to your local medical officer of health, because I do think that, as I've said,
Ford the other day said that medical officers, weren't doing what they need to be doing. So without this information in each area, how can people make the decision to know whether to go out and be safe?
So I think, as everyone knows, that people of older age are at much higher risk of severe outcomes. And where you are really matters right now, because the disease activity is different and the local medical officer of health is in the best position to do that. Of course, having said that, in many communities, there are different approaches that people have taken. Like even in grocery stores, people have a certain hour where perhaps seniors can go and shop as opposed to, other age groups. So there's many ways in which I think different communities are looking at how they support the seniors, because it is very important that they be able to, have those connections and be able to do what they need to do to sustain daily activities. But it is actually very different if you were living in, different cities or different towns. So you do have to ask that question of your local public health.
Thank you, Dr. Ceci met fin à la conférence de presse pour aujourd'hui.
Thank you. This concludes today's press conference.
Merci. The conference has now ended. Please disconnect your lines at this time